maternal and child health access back in January, and really one of my first major projects was to dive into Medi-CAL'S non-medical transportation benefits. So I'm becoming an expert on the topic, so hopefully this will be useful to everyone. And again, you know, we really want this to be as interactive as possible. I know sometimes people can get lost in a webinar and kind of drift away, so I'm trying to keep it really interactive. I have several polls or sort of pop quizzes during the webinar, but again, just feel free to type in your questions so that, you know, if something doesn't make sense as I'm talking about it, you know, I can try to address it at the time. And if I miss it, Medi-Cal is going to try to, you know, alert me to the fact that there's some questions that I hadn't addressed. All right, so let's get started. Okay, so we're starting out with a poll, real simple one. Just want to get a feel for what everyone on the webinar knows. So Medi-Cal is going to launch the poll, but it's, you know, do you know what Medi-Cal's non-medical transportation benefit is? For anyone just arriving, we're just doing a quick poll just to get a feel for how many folks in the audience already actually have already understand what the non-medical transportation benefit is. The numbers keep changing. We've got 89% who voted.
Okay, 91%, 92. Should we close it there?
Yeah.
Okay.
We can close it. Okay, great. So we've got 39% that have an understanding of what it is already, and the rest are either no or maybe unsure. So hopefully this will really be helpful to everyone. All right. So what is non-medical transportation? So it is round-trip transportation to and from a doctor's visit, a pharmacy to pick up prescriptions, medical supplier to pick up medical equipment or devices, to visit your baby in the NICU, to receive, like the point is to receive any Medi-Cal covered service, including mental health and dental services. So if someone is in a Medi-Cal HMO and they're trying to access a carved out service such as mental health or dental, they could still go to their Medi-Cal HMO and they would still have to provide that transportation. So it's anything in your scope of benefits as a Medi-Cal beneficiary. And again, it's round trip transportation. Any questions on that? Okay, another poll. There's not going to be this many polls, but we just want to try to dig in and really emphasize certain points. So wanted to know, who knows the difference? Does everyone know the difference between non-medical transportation and non-emergency medical transportation? It's NMT and NEMT.
Okay, we seem to be stopped at 85%, so I'll go ahead and close the poll there.
Okay. So we've got 31% that know the difference. Okay, so this is a really important point that I want to dig into because it's been causing a lot of confusion. So how is non-medical transportation different from non-emergency medical or emergency medical transportation? So there's all these names out there, NMT, NEMT, EMT. So Non-medical is different from non-emergency and emergency medical. So the non-medical transportation, this is really important, is for visits to doctor, dentist, pharmacy, other Medi-Cal covered services where the beneficiary is able to travel in a standard vehicle and does not need assistance getting to and from the car. And another really important point is that you don't need a prescription from your provider to get this transportation. You should be able to schedule it just by contacting the Medi-Cal HMO or going through the Medi-Cal fee-for-service process. You don't need to get that prior approval from your doctor. And again, so if someone's in a wheelchair, most likely they're not going to be able to access the non-medical transport. They have to be able to get to and from the vehicle on their own, no assistance from the driver, because sometimes they're just sending regular cars. In some cases, they'll even send a lift, so they don't, these folks don't have any sort of medical training to help the beneficiary. And so the non-emergency medical transport, the NEMT, and this is where people are getting confused calls, is, it's for someone who is sick and needs that assistance. It could be someone that's going for chemotherapy and they might not be wheelchair bound, but they might not be able to get to and from the vehicle on their own, and that would require that prescription from the medical provider. And emergency medical transport, of course, is transportation for an emergency that requires ambulance or airlift. So it would be an emergency, and it would also require that ambulance or air ambulance. So that's NMT, NEMT, and EMT. And we're just talking about NMT, because again, there's no prescription provided, and it's just for somebody that can get to and from the vehicle on their own. So I've been getting some calls from folks that their patients do require, they're in a wheelchair, or they really do need some assistance. They could be on a ventilator. They're going to need help from the provider. They're going to have special accommodations for them. So we're only talking about the NMT where they don't require that prescription.
Okay. Brigid, before you move on, we had a couple questions about NMT, which you can either take now or hold until it makes more sense. But one question was, does NMT include health education classes? And then the other is, does it include access to the regional center for children?
I mean, as long as whatever the service is covered by Medi-Cal. So I don't know if I would think that the regional center services would be covered by Medi-Cal. I know that sometimes they don't actually charge for any insurance, but Medi-Cal does cover those services, so that should be fine. Health education classes, again, it would have to be a Medi-Cal benefit, so I think it would depend, but I can check on that specifically.
Okay. Thank you.
All right, so another poll. So what's the main difference between NMT and NEMT? I'm really trying to drill this point home. The letter E, requiring door-to-door assistance from the driver, requiring a prescription from the provider for transportation, I don't know, or both these. We're just going to wait a few more seconds for, I've got 75% of the vote in. Okay, great. So it looks like 60% of you are understanding the difference between NMT and NEMT, and the correct answer is, of course, both B and C. That's the main difference is, the door-to-door assistance from the driver and requiring a prescription from your medical provider. So if you don't require door-to-door assistance and you don't require a prescription, then NMT is the benefit that you'd be looking for. So who is eligible for this benefit? So pretty simply, it's all Medi-Cal beneficiaries. So regardless of whether you're in fee-for-service or in a Medi-Cal HMO or managed care plan, as long as you're accessing a service covered by your scope of Medi-Cal, then you are eligible for this benefit within your Medi-Cal scope. And then the beneficiary will also have to attest to not having any other means of transportation to those medical services. So right now it should be that the beneficiary could just attest to this over the phone, just saying that, you know, I've exhausted my other resources. I don't have a way to get to my doctor visit or to visit my baby in the NICU or to pick up my prescriptions. This, of course, also includes women in all categories of pregnancy-related aid codes. Hopefully everybody on this call knows that if a woman is on a restricted aid code for Medi-Cal, when she's pregnant, she's getting all the benefits as if she's in full scope Medi-Cal. It's considered minimum essential coverage, and she gets everything medically necessary. Even if it's not pregnancy related, she gets that covered. So she doesn't have to worry about not being able to access something when she's pregnant. She gets everything. So she'd be able to she'd be able to go to a dentist appointment when she's pregnant, even if she's on that restricted aid code, and she could get the non-medical transport to get her to and from that visit. So another little quiz, just so everyone's understanding. So which scenario then meets the criteria for non-medical transportation? And just choose all that apply. I'm seeing some questions come up that we will be addressing in a few slides, so stay tuned. And we're at about 75% of the vote. Okay, we can probably close it out. So yeah, so actually a lot of folks, and maybe it's because I was driving this point home about the visiting the baby in the NICU, but actually both A and C, so both going to a doctor's visit where you can get to and from the vehicle on your own, and visiting baby in the NICU, those are both covered by NMT, the NMT benefit. And so of course the one B doesn't apply, because if the person is in a wheelchair that's trying to access this benefit and it needs assistance from the driver, they wouldn't be able to access the non-medical transport benefit. So I just wanted to point out, because I was talking about pregnant women who are on restricted aid codes and how they can access full scope benefits. Everything's medically necessary, both through their pregnancy and 60 days postpartum. But there, of course, are other folks that are not pregnant that are also on restricted aid codes and on their Medi-Cal. And so they would only be able to access the transportation benefit, of course, for any covered benefits within their scope. And so, it's fairly limited when you're in restricted aid code. So examples would include dialysis. As long as the person, the beneficiary going for the dialysis, can again get to and from the vehicle on their own. In many cases they can access that non-medical transport benefit. If they did think they were going to have difficulty, or if their provider thought they were going to have difficulty, then they would have to go through the non-emergency medical transportation benefit and get that prescription from their provider. Another example would be a dental emergency that would be covered within the restricted scope Medi-Cal, and so they would be able to get transportation to that dental emergency if they needed it. So what about emergency services? That's a trick question. Of course, an emergency would be covered by the restricted scope, but those services would be covered by the emergency transport by ambulance or air ambulance, not, you wouldn't be accessing non-medical or non-emergency medical. Okay, so another question that we get sometimes is what type of transportation would be covered? This puzzles me at first because the statute and the all plan letter specify all these different types of transportation, a ride service, a taxi cab, bus tokens or passes, train tickets and similar, but we haven't seen that ever. So everyone's always gotten some sort of vehicle that picked them up and dropped them off, and then picked them up after their appointment was over. So I can't imagine really a situation where somebody would go through this benefit to get a bus token. But I mean, it is out there. The health plans are also telling me that they'll provide gas reimbursement if a beneficiary arranges with a family member or a friend to drive them, and then they have to go through a process to get that reimbursed. But again, we haven't actually seen that happening officially. We've only seen people getting the rides. So are there limitations or restrictions? The short answer is no, there aren't. And there was some confusion about this earlier on. I mean, this benefit was only launched last, July 2017. So it's still relatively new. And so there were a lot of kinks being worked out, especially with the plans where there was confusion. So, distance, time, how many rides, there should not be any limitation. So your patients or the beneficiaries are, it doesn't matter how far they have to go. There are instances where the plan might say, oh, if you're going over county lines or if you're going over 50 miles, that they would need to verify the appointment to make sure that someone's not just going on a trip. But they shouldn't say, oh, you already went 10 times this month, we're not going to cover it anymore. All of those things should not be happening. So we certainly want to know if beneficiaries are getting that type of feedback, because it shouldn't occur. So I think one of these questions just came through a bit ago. So can parents or caretakers also take the transportation? So this is important. Yes. So it's really one attendant per dependent. So examples include an attendant or caretaker can accompany an elderly person. It could be their parent, or it could be, they could be just taking care of this person, but they would need to accompany them to their doctor's appointment. Or one parent or guardian or caretaker can accompany their child. We've gotten questions about, what if a parent is taking one child to a medical visit but they also have other minor children, and whether or not they can also take those children with them. And so some folks had been using the benefit that way, but then the medical HMOs pushed back and they said, that's not the service that we're providing, that you can't bring additional children unless they have a medical appointment. And we did verify with the state as well about what the statute says, and it is just for the one child that has the appointment. Now, if you have twins and they both have a medical appointment, you can take, both parents can go with each child. So it wouldn't be, so again, it's one attendant per dependent that is requiring the medical service. Oh, that's clear. I hope I didn't make that too confusing the way I explained it. All right. So another question is, are teens allowed to use the transport benefit on their own? And again, the short answer is yes. However, but parents would have to authorize their teens to use the transportation ahead of time if they're going through Medi-cal HMO for those services. They would just have to authorize it ahead on the phone. Now, we've been getting mixed messages about what the plans actually allow with this. Most of them are saying that the teen has to be at least 16 years of age to access the benefit this way without a parent. Even with consent, some of them aren't allowing it any younger than that. So the all plan letter does seem to give them the freedom to make this choice. Now, this is different for teens in health plans who are accessing sensitive services or family planning services. We're going to get into minor consent in the next slide, but if a teen is in a health plan and they are accessing family planning or quote-unquote sensitive services, then they are supposed to be allowed to arrange for the transportation on their own without their parents' consent, of course, because they are supposed to be allowed to keep that confidential. So it's an important distinction to make. And I think as time goes by, we'll get a little bit more information about exactly what's happening with the parental consent. But again, it seems like 16 is where they're keeping it. But if you do hear of any plans that, you know, a teen is trying to access these types of services and they're getting pushback on trying to schedule it without their parents' consent, then we would like to know about that because it shouldn't be happening. And that is one point that the plans do seem to be a bit confused about.
Brigid, we have a couple questions specifically about foster use with fee-for-service Medi-cal.
Okay, well, for anyone in fee-for-service, it's the same process, which I'm going to get to in a few slides. So I can. It's a fairly simple process right now, but it is an interim process. But it's the same. It doesn't matter if it's foster use or not. It's all one system.
Okay, thank you.
Oh, sure. Sorry, I got a little wild with my animation here. I was trying to make the webinar interesting. Okay. So how does this work for teens accessing sensitive services through minor consent Medi-cal? So this, of course, could be a teen could have insurance. They could have private insurance. They could be on a Medi-cal health plan with their parents. They could have this other coverage, but they are allowed to just apply for minor consent Medi-cal if they don't want, if they want everything to be totally confidential. So if they are using minor consent Medi-cal, they can access services related to pregnancy, family planning, sexual assault, and that's for children of any age under 21 can access the minor consent Medi-cal. And services related to sexually transmitted diseases or outpatient mental health or substance use disorders. So that's children ages 12 through 20. So those are just, I just wanted to point out those parameters for it. If you want more information about the ins and outs of minor consent, this is the MCHA fact sheet, which would be very helpful. So I just wanted to point that out because we're not going to dig into all the specifics of it, but minor consent Medi-cal is always fee-for-service. So when we get into the fee-for-service process for accessing the non-medical transportation, they would go through that process. They obviously wouldn't call a health plan because the minor consent is not administered through the health plans. So again, it's this now mysterious fee-for-service process that we're going to get into in a few slides. Okay, so here we are. How do beneficiaries access the NMT benefit? And so, of course, it does depend on whether or not the beneficiary is in a Medi-cal HMO or Medi-cal fee-for-service. So in the health plan, it's simpler. Technically, the health plans told us that everyone should just call the member services number. Now, that should still work. However, we did get feedback that some of the member service numbers weren't as informed about the benefit as others. So this list of numbers is just for LA, but it's a curated list, of the most direct numbers to call. Most of them are their direct transportation, their dedicated transportation line. Some of them it still is member services because they don't have a dedicated transportation line. But I would refer to these numbers if you're letting a beneficiary know how to access this benefit. This is also on our fact sheet on the MCHA website, which we're updating pretty much constantly because we keep getting new information. And so outside of LA, this is just a list of the member services numbers for the plans in all the other counties. So this, of course, is not a curated list of the direct transportation lines. It's just the member services lines. But I think most folks on the call are servicing Los Angeles. I'm just seeing a question that came through. I just wanted to clarify. So the question is, does this apply for patients undocumented with limited Medi-cal? So yes, because if someone's undocumented and they have the restricted scope, they're able to access the non-medical transportation, but only for those services that are within their scope of Medi-cal. So they wouldn't be able to go for just a standard doctor visit because that's not, just for like an annual checkup, that's not within their scope of benefits. But if they were having an emergency, well, actually, if they're having an emergency, they would go through the emergency medical transport. But say they had a dental emergency, or if they were undergoing dialysis and they didn't need assistance from the driver, then they would be able to access this benefit. I hope that clears that up. Oh, and just while I'm going through some questions, I see a question, will there be a concise handout or document specifying all this information? So currently on the MCHA website, we do have a fact sheet on all of this that was updated just Friday, August 10th. So it's very current. And we're probably going to be disseminating even like simpler flyers for people that are just trying to access the information really quickly and not kind of get into the policy info. But yeah, there are handouts. Okay, so how do fee-for-service beneficiaries access this benefit in Los Angeles? This is the big question, right? Because right now it's just an interim process. It's not as simple as just call your Medi-cal HMO. So right now, there's actually just an inbox on the DHCS website, and so you actually email DHCS benefits -benefits at dhcs.ca.gov. So that doesn't seem very promising, right? It doesn't seem like, oh, I can just access that easily. So this is also a fairly new process. This is one of the reasons why we keep updating our fact sheet, is because they keep changing who you're supposed to email. So right now it's this email. Now they're supposed to be triaging by priority. So my suggestion is that if you email this for your patient, for your client, explain the level of urgency and what this visit is for and when it is. I've had some experience working with them on this, and if they can see that it's an urgent, a more urgent visit. I had a woman who needed a fetal echocardiogram during her pregnancy, and they got right on it when I explained, she really needs to get to the doctor in, 3 or 4 days, and that's another thing, unfortunately, because it is just this one inbox. You want to let them know as far out as possible about this, but I wouldn't just wait on this email. If you're not hearing back, you can let us know if you're not hearing back. There's other people that you can potentially escalate it to. So we would want to know, and we can, email other people in the state. But again, they are triaging, so I would really try to drive home how urgent the visit is. And don't include the client's PII, their name, address, Medi-cal number in the email, because they just want to know, when is this appointment and what's it for, and then they send you back this encrypted message, and then that's when you can give all of the Medi-Cal number and their name and address and all of that info. And technically, beneficiaries can email this DHCS benefits email themselves, but I don't recommend it if you can assist them with it, especially because of this whole encrypted messaging process. I think that it throws some people off, and also, of course, some of the beneficiaries don't even have computers. So again, just let us know if you're having any difficulty with this, because I've been working on navigating this whole system. And again, this process will change, and we're going to keep everyone posted with our updated fact sheets, which again are on our website, but we can also be sending them out to the group. So I'm just really emphasizing this because the process was supposed to be in place officially July 1st. And so we thought by the time that we did this webinar that it would all be in place, but we are still waiting. So again, until further notice, it's this email address. So in other counties, how does this work? So that was Los Angeles County. So unfortunately, in other counties, they still have this added step where now this is just a list of all of the contacts in each county that you're supposed to attempt to contact first before contacting that same DHCS benefits email address. So, and something confusing in this PDF is that there is a woman listed for Los Angeles who is not actually the contact. You're in Los Angeles, you just go direct to DHCS. And again, if this contact doesn't work on this other county list, then you're supposed to contact DHCS after that. But there are phone numbers on this list. So if anyone's in another county, I would suggest just calling and say, hey, can you help me with this? And as soon as they say no, just email the DHCS inbox. So I'm just looking at questions here. Okay, so I just wanted to point out where eventually the non-medical transport providers will be listed. So the state has told me that it's at this transportation services page on the DHCS website. This is where they're going to be posting the actual list of non-medical transport providers. So eventually a beneficiary could just go to this page and find the list and then just contact the NMT provider on their own. And hopefully that will work nicely and smoothly. I go on that website almost every day to see if that list has popped up. But so that's where it should be. But again, we're going to let everyone, we're going to keep everyone posted as that process comes to play. All right, so another pop quiz. Which of the following is not covered by the non-medical transportation benefit? A trip to the pharmacy to pick up a Medi-Cal covered prescription, mental health provider appointments, dental appointments, all of the above, none of the above. And again, it's which of the following is not covered? So it's sort of a tricky question. Okay, great. The majority of you got my tricky sort of double negative there. So the correct answer, of course, is none of the above. All of those are covered services by the non-medical transportation benefit, a trip to the pharmacy to pick up a Medi-Cal covered prescription, mental health provider appointments, dental appointments. And so we wanted to drive that point home, since the mental health provider appointments and the dental appointments are those carved out services. So even if someone's in that Medi-Cal HMO, they should be able to get that dental appointment transportation covered. That shouldn't be a problem. Okay, so potential barriers to accessing NMT, and dental could be one of them actually. So health plan members may experience the following. We haven't really seen barriers for fee-for-service beneficiaries, other than the fact that there's not an official process yet, but fortunately for scheduling transportation for any fee-for-service beneficiaries, you're going directly to the state, so they actually understand the benefit, which is helpful. So in the health plans, I've discovered actually just contacting them, trying to find out what they're telling folks. Now, each plan does require advance notice for any sort of non-urgent Medi-Cal covered service. So it's ranging from 24 hours to 7 business days. So that's a pretty big range. So unfortunately, folks do sort of have to be on top of if they're scheduling an appointment, if they know they're not going to have access to transportation, to try to schedule that transportation as early as possible, because 7 business days is a long time. Now, if it is something more urgent, like say it's somebody in a Medi-Cal HMO and they think they have strep throat and they need, they're like, I really need to get antibiotics. They should be able to emphasize that to the plan, and they should be able to schedule them within 24 hours. Some of them say that they might be able to schedule within a few hours, although they did say that would be trickier, but they should be able to do it within 24 hours. So some plans were requiring providers to fill out request forms for the non-medical transportation, and this is not required for non-medical transportation. It is required for non-emergency medical transportation, and so that's part of the confusion between those two benefits, especially if someone calls up their plan and doesn't specify what type of transportation they need. They should really specify, although it's not natural to do so, is to say, I need non-medical transportation. And of course, that's a very strange thing, I think, for a beneficiary to say, because obviously they think they are accessing medical services, but it's called non-medical transportation. So that will just require some education for the beneficiaries, and hopefully eventually, the plans will be completely on board with understanding, somebody might not know to ask for it that way. But yeah, so they should not be asking for those forms to be filled out. And so that is the confusion over the process being different from NEMT. So I mentioned earlier that some of the plans, if the beneficiary has to cross county lines or go over a certain distance, 25 miles, 50 miles, then they're most likely going to need to verify the appointment. But usually that's just going to require that they call the provider ahead of time and just verify, does this person have an appointment, and that's it. And something else I came across when I was calling the plans is that some of them are confused about what Medi-Cal actually covers. And because they might be confused about what Medi-Cal covers, then they are confused about what the transportation benefit covers, because of course the transportation benefit covers everything that the beneficiary has access to with their Medi-Cal. So for example, one of the conversations I had with one of the plans that was a bit confusing was that they didn't understand that dental had been restored for adults in Medi-Cal for 2018. So they said, oh, they can only get the transportation if they have an emergency dental situation. And I had to explain to them, that's not the case. But so those are the sort of things that, unfortunately, we all have to kind of be on top of, understanding exactly, the scope of benefits and what's actually covered, so that, we don't get pushback from the plans without, being able to tell them what should actually be happening. So again, we would like to know if folks are getting that kind of pushback. So again, whether the beneficiary is in Medi-Cal, managed care, or fee-for-service, all Medi-Cal covered services have access to this transportation benefit. And again, those carved out services should be covered by the Medi-Cal HMO, even if it, even if it's a Denti-Cal carved out service, they should still be able to schedule the transportation through their Medi-Cal HMO.
Brigid, we had one question that I think is relevant, which is, what does it mean to, quote, exhaust other options? So if a parent has a bus pass issued to them and they could take the bus, but the ride would be extremely long, could they use non-medical transportation benefits?
Yeah, I mean, it's what's reasonable for them. If it's going to take them several hours, and they're going to have to take several buses, and they have several kids that they have to take with them, that's just not feasible. I mean, I think essentially, as long as they can say, I don't have a car, I don't have access to a car, no one else can take me, it's not feasible to take public transport, that should be fine. They're not. I haven't heard them getting into any specifics with folks of, like actually asking them to go through all of their options. They just have to attest to really not having any access to reasonable transportation.
Okay, thank you.
So we wanted to outline for folks, what to do if your clients are experiencing problems accessing the non-medical transport. So for beneficiaries in a health plan, they should, or their advocates could email Renee Mala with a CC to Lori Weaver, or both at the state level. Also, filing a grievance with the health plan is also an option, and this can just be done over the phone. I think sometimes folks think it's a much more complicated process, but you can just say to member services, I want to file a grievance, and then they have to go through the process with you. This might seem daunting, but you can also, so you can email Renee and Lori, file a grievance, and concurrently, you can also ask for a state hearing, and you can do that. There's an online form that you can link out to, or you can call this 800 number. And then after filing the grievance, so all of these first three steps can actually happen at the same time, but then if you wanted to also go through the Department of Managed Healthcare and file a complaint, that would happen after filing the plan grievance. That you don't go to them first. You have to first file the grievance with the health plan and then go through DMHC, which again, this is the phone number, this 888 number, or you can fill out the online form. So there's all these ways to try to file a complaint with a health plan, whereas with the fee-for-service, the only option really is to ask for a state hearing with this online form or by calling the 800 number. Again, we also want to know about these issues, and I think that out of all these processes, like emailing Renee and Lori, like emailing the state and saying this is a problem, like that's going to get it fixed probably the fastest, but these other processes are helpful in terms of documenting it so that it can be seen whether or not there's a trend with that health plan that they're causing these barriers for people. So something else, now this is outside of the non-medical transportation benefit, but we just wanted to mention that transportation is also an option through CCS, California Children's Services. And I'm by no means an expert on CCS, but it was brought up to me when I was trying to schedule transportation for a woman who's in fee-for-service. She's undocumented, and so she's on a restricted aid. Of course, she has the full scope benefits through the pregnancy and 2 months postpartum. So she had her baby very prematurely, and she was still in her 60 days postpartum. So she was able to access the non-medical transportation benefit to visit her baby in the NICU for those 60 days. But the state did bring up to me, they said, is the baby in CCS? Because they could actually arrange transportation for mom. And they brought this up because after those 60 days, she wouldn't be able to access the NICU benefit. So it's just good to know that this is also an alternative if for whatever reason the non-medical transportation benefit isn't an option anymore. And so I just wanted to include the 800 number and the website. And so, you know, anyone interested in going through that process, you would just contact them and you know, see about the eligibility. You know, they could arrange for rides, parking, food, lodging nearby. So all of those things could be helpful. So what if clients are still having problems? So you've gone through contacting Renee and Lori, you've filed the complaint. You can contact me. You can also contact me before you go through that whole process, because we do want to document what's happening and you know, find out, you know, why there might be confusion, especially at the health plan level, because you know, we would work on that and try to get that to improve. And we want to understand how to tell people to advocate for themselves if there is confusion at the plans and if they're causing barriers to accessing health services. So advocates should give me a call or email me. I'm happy to help sort out anything, or even if you're just not understanding the just the DHCS process for fee-for-service or something like that, I'm happy to go over that over the phone, or, you know, explain how to advocate for your clients in that way. So separately, consumers should contact the Health Consumer Center in Los Angeles. They actually have a dedicated transportation line to help with transportation issues. And it's the Health Consumer Alliance in other counties, and so that's the number. So are there any other questions that have come up that I have not seen?
So there are a few more questions, and then I think we'll open it up again for any additional questions. But there was a question about the form that is filled out, and I'm not sure I actually fully understand the question, but Anna said they're asking for the form to be filled out. They have a checkbox. Does not require the doctor to sign, but they do require we fill it out.
Well, none of that should be happening for non-medical transportation. Is that
okay?
So that might be a non-emergency medical transportation. If they want the doctor to sign off on it and they need a form to be filled out, that should be for non-emergency medical. If they're actually requiring that for a non-medical, then that's a problem, and they shouldn't be doing that, because that's creating a big barrier.
Okay. And then there's some additional questions about like pickup time. So there's one that says if the appointment is waiting, the appointment is running long and the client is waiting for hours to be seen, is there a cutoff for the ride? And then another one is it says it seems that sometimes drivers who are to pick up a client leave very quickly. What advice do you have for beneficiaries when they're supposed to be picked up?
So, sorry. So the first part is there a cutoff for like how long the driver? Like if you say, oh, my appointment should be over at 4, but it hasn't ended until 5:30, and they're just like, how long will they sit there?
Right. And then I think the other one is if the driver leaves without, because they're waiting for the patient, what can the patient do in that situation?
Well, okay, so I don't believe there's a cutoff for the driver in terms of how long they will wait, but I can check on that to see if there's any sort of parameter around that. But in either case, they have to send the driver back. I mean, I think the first recourse would just be contacting the number for the driver and having, well, it wouldn't be for the driver, but for the transportation company to have them send out somebody new, because when they set up the transportation, they give the name of the company and the phone number for the company for scheduling. So I mean, that would be the first thing that they have to do. Separately, of course, they can file a complaint about them leaving them there. And I know that the Health Consumer Center, like, they have their transportation line deals deals with, you know, it says on their flyer, you know, if the driver doesn't show up, you know, call us and we'll, you know, help file a complaint about that. So unfortunately, I don't have any other advice around that, but I will check specifically on if they're, you know, if the driver is told they don't have to wait a certain amount of time. I haven't seen that written anywhere specifically, but I will check. And again, I would hope that just calling the transportation line, you know, in the moment, I think that would be the fastest way. And I don't know of another recourse for the beneficiary.
Okay, thank you. So I think that the question about the form, this person says that some NMT requests are being asked to fill out the form, which I think you mentioned that doctors were originally doing that, even though they're not supposed to. So what would be the recourse if for non-medical transportation, a doctor's office is asking for a form to be filled out? How can the client or the home visitor help?
Like the doctor's office is asking for the form to be filled out? Is that what you said?
I think so. I think that's what. Anna, if you can add any additional clarification to your question, but I think that's what she's saying.
And they're actually asking the beneficiary to fill that out? Because that's, I mean, that's just, I don't even know why they would want that. Because again, that would only be, the only form involved is when it's the non-emergency medical, both the prescription and the form that needs to be filled out. But for non-medical, the providers are just causing for themselves to require paperwork. The providers have to be involved, unless they are trying to assist with the fee-for-service process. But again, that would only require an email to that DHCS benefits. There shouldn't be this additional paperwork involved. And even if the plan, like if the person's in a health plan and they need to, you know, it's that 50-mile appointment over county lines, like all they have to do is attest, or all they have to do is confirm over the phone, yes, this person has an appointment at this date and this time. So all that paperwork should not be happening. I don't know, does that clear? I mean, you know, offline, if you want to contact me about, you know, what exactly is happening, because that's really, it seems like there's confusion. I don't know if it's happening with multiple providers or a particular one.
Yeah, I think that would be good. I think if anyone has any specific questions about individual cases that they're struggling with, it might be best to email Brigid.
Yeah, and I mean, it's helpful to us too to understand, you know, that certain things are still happening or new weird things are occurring, you know, to help navigate that. Okay, are there any others? I'm seeing paragraphs here come up in the. So do we want to, I mean, do we want to get to more questions now, or do we want to have Helen talk about the spreadsheet?
Let's pass it to Helen just for a second, and then we can take any last questions in the time we have left. And okay, Helen, I'll go ahead and unmute you right now.
And I'll go to the slide.
Can everybody hear me?
Yes.
Yeah.
Oh, good. Okay. Thanks for these 2 seconds. Brigid, I'm so glad you're an expert on all of this. Thank you so much. We just wanted to take the opportunity on behalf of the referrals work group for the consortium to let everybody know that we do have an upcoming resource. What you see on your screen is just a screenshot of the transportation spreadsheet that we will be finishing up shortly, which is a list of not related to Medi-cal or medical transportation, but just any free or low-cost transportation services available countywide. So we're trying to have this be a really comprehensive list of everything available in any service planning area of LA County. So do look for it in the coming weeks, and we'll also be posting it to the consortium website. If you have anything if you know of any transportation services that are available in your area that we might not have found otherwise, feel free to contact me or Michaela so that we can include it as well. Thank you.
Thanks, Helen.
Okay, in the last minute or so that we have left, if there are any general questions that you have still or that haven't been answered yet, please feel free to type them into the chat box.
So I do see a question from 151. It says, what is the phone number to call for those who do not have an assigned plan? Well, so if they're not assigned a plan, then they would still be fee for service at that point, and so they would go through the DHCS benefits email.
I guess one reminder question, I know you covered this, but the question is, does the health plan provide transportation on their own, or does the patient have to provide their own means of transportation and the health plan will reimburse for it?
Well, so in most cases, you know, the plan, if you're contacting the plan to get the non-medical transportation, they're setting up a car to be sent to pick you up. There is the option if someone, if not for their own vehicle, but if they are asking a friend or family member to provide the transportation for them, then they will provide, you know, mileage gas reimbursement for them if they want to do it that way. But in most cases, when they're setting this up, it's just to get them to go through a transportation company to set the driver to come and get them.
Okay, and then I think, so this last question again is just a clarification, but in a nutshell, basically the folks in various counties contact their local managed care plans for transportation. The answer to that is yes, correct?
Oh, yes. Oh, sorry, you said in what, just in other counties?
Yes.
Yeah, so anyone in a health plan, the way to schedule is to contact the health plan. And so the easy answer to that is it's member services. The numbers that I have listed in the slide and also on our NMT fact sheet, those are actually, it's like a curated list of more direct transportation lines for the health plans in Los Angeles. But yeah, the easy answer is, so, you know, it should be whatever number is on their card for member services, that should get them there. If they are having trouble, you know, if that number, they sound like they don't understand the benefit, we would want to know about that to find out if there's another way for, like, if there's a number, a dedicated transportation number for that plan, because that might be an easier way for them to get it.
Okay, thank you. Well, we are actually a few minutes over time, so I think we will have to stop there. We will be giving Maternal and Child Health Access a list of all of these questions that came in through the chat log, so hopefully they can try and include some of this information if it's not already in the memos they're creating. They can include that. As we said, we will be sending out the recording of the webinar as well as the slides, though we may hold off for a little bit because as Brigid mentioned, information about how to access the non-medical transportation benefit specifically for fee-for-service enrollees is forthcoming, or I guess it's changing rapidly. But
the official process has not been announced yet. So.
Right, thank you. But we will make as much information as possible available to you as soon as MCHA knows. So thank you so much to Brigid for being such an incredible wealth of information on this, and to Maternal and Child Health Access generally for being such an advocate in getting all of this information from the state and keeping on top of the state for getting more clear guidelines. We will keep you all up to date as much as we can. And please feel free to follow up with Brigid if you have any questions specific to individual cases you've been working on. Anything else?
Definitely don't be shy, contact me.
Okay. Brigid, would you maybe just go back to the slide with your email for a moment so we can remind folks?
Oh, sure. Yeah, so that's my email and my phone number with my direct extension. You can just call the main number and ask for Brigid. I'm the only one. So yeah, and we're going to go through those questions, and if there's anything that I missed or if there's something that I need to research more, I'm happy to do that, and we can send updated information out with the recording of the webinar and any other documents that we have. We're really trying to make sure everyone has all the details about this and the most up-to-date information, because it keeps changing.
Okay, thank you everyone, and thank you again to Brigid and Maternal and Child Health Access, and we will be in touch with additional materials. Have a good rest of your afternoon.
Thanks, you too. Thanks, Medi-Cal.
Thank you.
Thanks, everyone.